Okay, folks, so this week we are basically looking at Chapter 6, um, Federal Efforts to Enhance Quality of Patient Care Through Use of Health IT. So one of the things that, like we talked about in earlier weeks was there was kind of an infusion of health IT in the last 10, 15 years. Actually, more to put it, in the last 8 to 10 years, okay? Um, Now, one of the things that has always been a great paramount of argument or discussion is technology worth the investment? And one of the when the regulators and the MDs that were getting together and deciding upon, how health IT can be useful, they said, okay, we have to use something. We have to have a procedure or steps or certain objective measures to really see if there's the IT is really use of IT in health context or healthcare context or patient care is really useful. So we came up with the stages or phases of meaningful use, and we're going to look at it in a few of the articles that you have for reading for this week. Um, so uh, so look at the HITECH Act as a component of HIPAA. It's essentially focused on information, how information should be shared, how digital information should be shared. Information Technology, Economic and Clinical Health Act established Medicare and Medicaid programs. Overview of the HITECH Act. So you want to get a sense of what this means, what it does, what are the regulations and policies that are part of the HITECH. What are the goals of HITECH? So what really? So when you are asking a doctor to use information technology, you're offering some incentives. So that was the whole idea about the Affordable Care Act, is that when doctors are there's a stipulation on the doctors to use technology, stipulation on the hospitals, basically the providers, to use technology for patient care. There has to be some incentives. So you read through those incentives, and really those incentives are only, you can only meet or you can only get those incentives when you meet certain standards, certain goals, okay? And those goals are laid out by the meaningful use concept. So you want to just go over the overview of the EHR incentive program and the meaningful use, what it needs, what doctors and hospitals had to do to be eligible, um, um, what is meaningful use essentially, and all that. Okay. Healthcare Reform Act, two proposed frameworks, the ACOs and the PCMH. Very important to understand what the difference between ACOs and the PCMH, and how are they linked with the whole health IT umbrella. Uh, New forms of payment that were introduced with this whole infusion of health IT. Health information exchange, what are they? What are the benefits? Nationwide HIE. Um, and then a brief summary. Then we go on to the articles reading for the week. Basically, we look at the first article, electronic health record. I mean, one of the articles, I won't say the first, is technology innovation. It's a Brookings Institute, January 2015, sustainable business model for health information exchange platforms. So health information exchange platforms are like, so you have a doctor, let's say in Beaumont, and you relocate to California, right? Or let's say for now Louisiana. Okay, so now if the two doctor clinics are linked with a HIE or health information exchange, it's easy to transfer information, your medical records, digital medical records, from one clinic which based out of Houston to the other clinic in Louisiana. So you want to read about this, the HIE stuff, and kind of get a sense of what they are. What is interoperability? That's a huge topic of discussion and debate in healthcare. Now, another one is another article talks about electronic health record systems and intent to apply for meaningful use incentives. This is a 2012 article, very relevant, must read. And this health affairs article is one of the top journals in the field of medicine. Most physicians were eligible, but few had EHR systems that met meaningful use criteria. So this will give you a better sense of what the meaningful use criteria are. Of course, the chapter will. but this will also give you a sense of what it is. Okay. With that said, that's the end of the video. Thank you.